In this scenario, we drop in on a medical appointment for a patient in her late 60s who has been diagnosed with chronic obstructive pulmonary disease, or COPD. The patient is joined by her partner and is being seen in her physician's office. During the conversation about treatments that are available, the patient initially wants everything done to keep her alive. The physician explores the patient's goals and values, and upon learning about the realistic outcomes and burdens of various treatments, the patient chooses to limit certain treatments on her pulse form.
Susan, you've been really sick since the last time you were in the office.
Yes.
So what happened?
I had pneumonia.
And I understand from looking at the hospital records that you were back on a ventilator, back on a breathing machine again.
Yes, I
So
was.
you've tolerated the breathing machine 2-3 times now that when you've gotten sick before. How was it this time?
Not good.
Just didn't like how it made you
I
feel?
think she was really uncomfortable this time.
Took a lot out of you, did it? Yeah.
I did.
Now that you're home, tell me a little bit about, how is your life different? What are you able to do? What are you not able to do? How are you getting along?
Pretty well.
Are you able to do pretty much what you need to for yourself?
No, I really have to do a lot of the care for her. Help her get bathed and from room to room and so forth. Because she
How
gets
far
it
can you
before-
walk now without having to stop to catch your breath?
Not that far.
So that's a significant difference from what it was before you went into the hospital, isn't it?
Yes.
We know that with this type of disease, and I think you know it already, that you'll have episodes where you have infections, you will continue to get a little bit more shorter breath, be able to do less for yourself. That's the tough part of this disease.
Yes,
It's
I
very
know.
difficult.
I was looking at your chart, and I'm kind of surprised to see that you don't have an advanced medical directive. Do you know what that is?
Yes.
Yes, we do.
Yes.
Yes, we're aware. We just haven't gotten around to it.
No, we haven't.
Well, an advanced healthcare directive would give you an opportunity to choose Ginny, or maybe someone else that you would choose, to make medical decisions for you if you were so sick you were unable to make them yourself. So one of the things that I'm hoping to happen here is, yes, we'll sign this advanced directive form, but I hope it stimulates some discussion between the two of you, how much intervention that you want. Okay?
Okay.
So this is a form, and I'm going to give it to you, and I think you guys need to spend some time discussing it. Okay?
We will.
We will.
So tell me a little bit about what you want as you look forward. If there's a crisis that comes tomorrow, do you want to have CPR?
Yes.
Okay.
Definitely.
Okay. And comfort is important to you as
Yes.
well, isn't it?
Oh.
Okay.
Yes.
So let me talk to you a little bit about CPR. CPR is done when someone has no pulse and has stopped breathing. So if I ask you whether you want CPR, it's not really a fair question, because it doesn't put it in the context of how sick do you need to be to require CPR. Especially with a woman with an advanced illness like yours. If you stop breathing, if your pulse stops, your chances of having a significant recovery after CPR is low, really low. And the quality of what life you might have, should you be lucky enough to survive, would be unlikely to be very good. So you probably watch CPR performed when you see characters on television pushing on your chest, maybe a bag over your mouth with some oxygen and air being pumped into your lungs. Is that something that you would want?
No.
Okay.
No, it's not.
So,
Well, we want to honor her wishes.
so for sure, we want to make sure that you're comfortable. We want to make sure everybody's comfortable, regardless of what kind of decision they make. Okay?
Yes.
But now that we've talked about that a little bit, there's another form that we should talk about called a pulsed form. and I don't know if
What's
you've
that?
heard of that. PULSE stands for Physicians' Orders for Life-Sustaining Treatment. So this is a way of taking your wishes, putting them down on paper. I would sign it, you would sign it, and that becomes the order to physicians in the future about how much or how little to do as you become sicker.
Okay.
Okay?
Okay.
Well, if we have an advanced health directive, do we have to have that before we fill out the PULSE form?
Well, you don't need to have an advanced directive. I think that it's great in the sense that you've already appointed, Jenny to make decisions for you, and that will be the same name that appears on the PULSE form. I think that that is convenient, but a PULSE form can be filled out without having to have an advanced medical directive, but I think both are important.
Okay.
So let's go through this pink form. Section A is about cardiopulmonary resuscitation, and we've sort of had that discussion now. And I think I'm pretty clear from what you're telling me that you don't want to have any attempt at resuscitation in that way. Is
No.
that right? So I'm going to go ahead and mark that part as no. Now the next part goes through medical interventions and sort of talks about how much you would want us to do if you become sicker. Okay?
Okay.
So I think I'm fairly clear from our discussion that one of the choices is full treatment, and I think you don't want that because full treatment would mean CPR, would mean being perhaps back on a ventilator, and I think you don't want that.
I don't want that.
And I think that, so if you develop a little bit of a bronchitis or you get a little bit short of breath in the middle of the night, you're still thinking that you'd like to go to the hospital and maybe be treated in the emergency room and maybe
Yes.
get antibiotics.
Right.
Is that
Yes.
right?
Yes.
As long
So-
as there's a chance of getting better,
Sure.
absolutely.
So
Yes.
that means that we don't want just comfort measures. Everyone, of course, gets comfort measures, but that's not the only thing you want. You want some treatment as well.
Yes.
Okay. So there's a place in between called limited additional interventions, and in your case that might be breathing treatments, that might be antibiotics, something to just get you over the hump, to get you back to feeling better.
Would that be all right?
Yes. Yes.
So I'm going to go ahead and mark that for you, okay?
Okay.
The next part involves nutrition. And what it really means is that if you're unable to eat normally, are we going to put a tube from your nose and into your stomach or through your abdominal wall into your stomach?
No.
Okay,
No.
okay.
No.
So we'll fill that out as well, with no artificial nutrition by tube.
Definitely not.
Okay. So then what we need to do last is make sure that you sign it and that I sign it, and make sure that everybody knows how to get a hold of Ginny and knows that she speaks for you when you can't speak for yourself.
That's right.
Okay? And so putting it on the fridge or next to the bed or somewhere where in a urgent situation somebody can find it is going to be really important. Bring it to your doctor visits with you. I'm glad we had an opportunity to talk about it, and I hope you guys have a chance to talk about it some more so you can flesh out your wishes.
We'll continue to talk about it, definitely,
good.
and we appreciate your help.
Sure, great.
A few of the key points about PULSE that you just saw include the importance for patients to understand what CPR entails, as well as the realistic success rates and burdens of treatments such as CPR, in order to make truly informed medical decisions. Choosing CPR in Section A requires full treatment in Section B. PULSE may be completed by a healthcare professional, but must be signed by a physician and the patient or their decision maker in order for it to be valid. PULSE complements but does not replace an advance directive. The advance directive names the decision maker. PULSE documents wishes if, in the future, the patient cannot speak for him or herself.